I want you to imagine an ordinary morning. The sun is just peeking over the horizon. Birds are singing. In a cozy living room, you see Mrs. Bennet, age 70, sipping tea and reading the newspaper. She's always been active, gardening, walking with neighbors, baking for her grandchildren. Today, though, she pauses. She feels a tug in her chest, a bit of weariness she hasn't had before. She rubs her temples, thinking, maybe I'm just tired. A week later, she notices a small lump under her arm. Nothing huge, just a firm bump she can feel when she moves. Her husband suggests she visit the doctor. Though she's nervous, she agrees, because something in her gut tells her, this is different. What cancer is, and how it begins. You see, inside her body, and inside all of us, there are trillions of cells doing their jobs. Some make skin, some make blood, some repair damage. They grow, divide when needed, and then die off when they're old or damaged. All in balance. Cancer is when some cells break that agreement. These cells start growing when they shouldn't. They don't die when they're supposed to. They pile up, pushing aside healthy neighbors. Sometimes they stay put, sometimes they spread, like seeds carried to new places. That's how tumors form, and how cancer can invade organs that had nothing to do with where it started. It could begin in the breast, the lung, the colon, the skin, anywhere really, wherever cells decide to revolt. Why it happens, causes and risk factors, so what makes cells rebel? Often, it starts with damage or changes to their DNA, the instruction manual inside every cell. That damage might arise from things like cigarettes, pollution, radiation, certain chemicals, viruses, or even mistakes that naturally accumulate over time. Some people inherit weak points in their DNA. Some damage just happens by chance. When Mrs. Bennet was younger, she smoked lightly for a few years, though she quit decades ago. She also spent many hours in the sun without strong protection. Over time, those exposures may have left tiny scars in her cells. Combine that with getting older, which always gives more time for such damage, and the risk grows. How it shows up, signs and symptoms. Cancer doesn't announce itself with trumpets. It sneaks in. For Mrs. Bennet, it was the lump. But there are other clues: sudden weight loss, without trying, feeling tired all the time, pain in one spot that just keeps getting worse, coughs that don't go away, bleeding, or sores that don't heal, changes in how often you use the bathroom, swellings, lumps, or new growths. In her case, the lump under her arm, something she never felt before, was the first red flag. Finding out, diagnosis. At the clinic, the doctor listens, examines Mrs. Bennet, and asks about her symptoms. He orders blood tests and imaging, maybe an X-ray or CT scan, to look inside. But the definitive test is the biopsy. They take a small piece of tissue from that lump and look at it under a microscope. The tiny, erratic cells, different from normal ones, tell them, yes, this is cancer. Next come extra tests. What kind of cancer is it? How aggressive? Any special features, like gene markers, that help decide treatment? That's how Mrs. Bennet's tumor is identified. A breast cancer that has some traits the doctors can target more precisely. What happens over time, progression, natural history? If left untreated, cancer tends to grow, invade surrounding tissues, and send out seeds, cells, to other organs via the bloodstream or lymph system. Some cancers are slow and take years, others move fast, in months or weeks. Because Mrs. Bennet's was caught fairly early, when she felt the lump and went straight to the doctor, it's less likely to have spread. But her medical team still must check for signs that it might have. That's part of the urgency. How we fight it, treatment options. Once the doctors know what they're facing, they draw up a plan. For Mrs. Bennet, the plan has several parts: surgery, remove the lump, and perhaps nearby tissue, radiation therapy, use focused rays to kill cancer cells, chemotherapy, drug therapy, medicines that travel through her body to reach cells that doctors may not see, targeted therapy or immunotherapy, newer treatments that aim more precisely at cancer's vulnerabilities, supportive care, good nutrition, pain relief, managing side effects, keeping strength up. Often, treatments are combined. Surgery first, then chemo or radiation, or both, attacking from different angles. The trade-offs, benefits, risks and side effects. The goal is clear: destroy or control the cancer, stop it spreading, improve life expectancy or quality of life. But these treatments hit everything, not just cancer. Mrs. Bennet might lose her hair. She might feel nauseous. She'll likely feel tired. Her appetite may suffer. Her immune system could weaken, making her prone to infections. Some treatments could strain her heart, kidneys, or other organs. Her medical team will carefully weigh benefits and risks, trying to pick the option that offers the greatest hope with the least harm. Watching the path, monitoring and follow up. Once treatment begins, doctors don't just walk away. They monitor closely, repeat scans, imaging, and tests to see whether the tumor is shrinking, blood tests to watch for organ stress or treatment toxicity, physical exams, feeling for lumps, checking symptoms, asking about side effects or new problems. If things change, if cancer returns, or spreads, or side effects become dangerous, the plan shifts. It's not a one-time fix but a continuous dance. Preventing what you can, prevention and AMP, risk reduction. Cancer isn't entirely preventable, but many cases are avoidable or caught earlier. Here's what Mrs. Bennett, and anyone, can do. Quit or don't smoke. Eat clean, lots of fruits, vegetables, whole grains. Stay active. Keep your weight in a healthy range. Guard skin from strong sun, sunscreen, shade, clothing. Avoid excessive exposure to harmful chemicals or radiation. Get vaccinated against viruses known to raise risk, like HPV. And follow screening advice, mammograms, colonoscopies, etc. These are defenses, not perfect shields, but strong ones. What the future holds, prognosis, outcomes. When Mrs. Bennett asks, "What are my chances?" the answer is, it depends. It depends on what exact type of cancer she has, how early it was found, how aggressive it is, her overall health. Because it was found at a relatively early stage, with no clear signs of spread, her prognosis is favorable. Many people in her situation are cured or live many more years. Others may live with cancer as a chronic condition. Some cancers, if advanced, can be life-limiting. But the earlier the detection, the better the outcome. How life changes, impact on daily life. Cancer changes life. Mrs. Bennett will have days she feels worn down, weak. She'll miss certain outings or errands. She may skip social events. Her body may look different, hair loss, scars, changed skin. Sometimes treatments will confine her to bed for a day or two. Emotionally, fear will peek in. Worry about what comes next. But there's hope, too, strength, support, family, meaning. She'll need help, from loved ones, caregivers, doctors, perhaps a counselor. She'll need to pace herself, give in to rest sometimes, but also fight for moments of joy. Other health challenges in the mix, comorbidities, interactions. Mrs. Bennett doesn't just have cancer. She has high blood pressure, some mild osteoporosis, maybe arthritis. These conditions affect what treatments she can safely receive. Some drugs might aggravate her heart. Others might interfere with meds she's already taking. Her care team must juggle all of it. Taking charge, patient self-management. Though she's in treatment, Mrs. Bennett isn't powerless. Here's what she does. She takes each medicine exactly as prescribed. She shows up for every scan, test, and appointment. She listens and reports side effects early. She tries to eat nutritious food and rest when she needs it. She keeps moving gently, walking when she can. She washes hands, avoids crowded places if her immunity is low. She leans into support, family, friends, support groups, spiritual care. She holds on to her hobbies, maybe a little gardening, reading, music, to remind herself who she is beyond being a patient. Closing, reflection. Cancer entered Mrs. Bennett's life in an ordinary way, a lump, fatigue, a nudge to go see the doctor. But from that moment forward, she walked into a journey that demanded courage, information, help, adjustments, and hope. It's not a simple path. There are good days, bad days, setbacks, adjustments. But it's also a path where people fight, survive, adapt. Where medicine, empathy, science, and human resilience meet. If you or someone you care for hears the word cancer, remember, you're not alone. Knowledge helps. Support matters. Early action changes everything. And for many, life continues, sometimes differently, but still full.